Hello, my name is Christopher Hall. I am an associate professor in counseling and marriage and family therapy in Souls. And I'm going to be sharing with you today about community engagement, particularly through our practicum course in CMFT. Practicum is an opportunity for our students to demonstrate the knowledge that they've been gaining over the last year. So our program is 2 years, and in that first year, there's intensive work done on self, but also on understanding skills, counseling skills, on understanding diagnosis and treatment, trauma, how to run groups. So they get the foundation in that first year, and practicum is their opportunity to actually use it. So the pandemic really hit us out of left field. So when March came, we had a cohort of students that were on their way out. And those students then had to basically switch to telehealth. And we have a very hands on at the site program. And all of a sudden, these students who had been working in the system for a year almost were then suddenly shifted to the only contact that they could have with their clients was through the internet. And this gave them a unique perspective because they had to then see both sides. We have to now see what happens when I, as a counselor, and also when my clients have to shift to this completely different modality when we're used to seeing people face to face. They also had to think about access and what happens when your clients don't have consistent access to the internet or access to a phone. And even with the students that we're currently working with, all they know is telehealth. So they just kind of started transitioning back into being on site, I would say back in September, but they spent the summer in telehealth and then about half of the fall in face to face. And they learned the differences between the two. So, what does it look like when I'm able to really do service delivery where service delivery happens versus now my client is at home? And for some of our clients, some of our folks, their clients might be homeless. So, do they have the same access to the internet to be able to do that work? Or I also have some folks that are working with kids right now, and the children don't always turn their cameras on because they don't want people to see inside of their homes. And just being able to adjust to people's needs in order to still do the same job, but in a way different fashion than they would if they were training without the pandemic.
Excellent.
As an instructor and a supervisor, it's always my job to have them think outside of their own perspective. So we really push empathy, but we also push objectivity. So, what does it mean for you to understand your client's position, but also remember that you're not your client? I know I do a lot of diversity work in how I get them to see clients. So we have multicultural models to help them break down all of the client's identities. And then what does it look like to fold those identities back into the client's current issues? So if the client is experiencing schizophrenia or depression, what does that mean to them as a person of color or their particular gender or the size of the body that they're sitting in and how these symptoms show up? Because there's no such thing as a one size fits all diagnosis. We have to be very cognizant of every intersection that the client has within them in order to do the work of diagnosing, but then also to do the work of intervening because of that access issue that we talked about a little earlier, to see where on the class scale that they're sitting or where on the transportation scale that they're sitting before we decide, okay, maybe this would help you. Does this help you in regards to what you're able to do and what you have access to? We teach the students empathy because it is absolutely dire for them to be able to connect. You can't be a counselor if you can't connect. You can't do the work if you aren't able to fully immerse yourself in the client's perspective and then be able to take yourself out of that perspective, the angles of the issue that they're experiencing. So that empathy helps them to say, I completely understand where you're coming from. I completely understand these particular feelings you may have. or I have experienced this same situation and now stepping out of it, how do we want to look at this differently? How do we want to understand this particular issue in a way that is counter to or complementary to the way that you've already understood it? And then having the client to be able to brainstorm different tools to solve this problem later on if it comes up again. But if you aren't able to empathize with the client and really understand their perspective, then you have more of a tendency of being judgmental. You have more of a tendency of not being able to really get to the client's level. Instead, you're always adjacent to it or around it, but you're never seeing it from the client's perspective. From the time that our students start, we are always interested in their own growth and their own development because the counselor acts as instrument. So we are basically a tool in the room, and everything that happens in counseling happens through the individual. So we are always ensuring that are you confronting your biases? Are you understanding your place in the world? Are you able to absorb other people's perspectives and not let it get in the way of how you do the work? And that is something that is consistent from day one. As a matter of fact, I had a student today talk about how they didn't expect to have to do so much self work right away. But I explained to the student that self work is imperative because this is the medium that you use in order to do the work itself. So if you are distressed, if you aren't doing self care, if you aren't always checking your privileges and understanding empathy, then it's going to be impossible for you to be able to do a good job once you're in front of the client.